This is a patient, a cricketer, fast bowler, who has pain while bowling for overhead activities. Now we are inside the joint doing arthroscopy, viewing through posterior portal. So we are having some problems with the viewing. There's a frayed margin of the posterior labrum which is coming in the view. So to get the better view, we'll shave off this frayed margin with the help of a shaver to get a better view. So once you have removed the frayed margin which are blocking views, so now we are looking at glenoid, biceps, head on 2 o'clock position. So we are probing the biceps anchor, which seems unstable. So we can move that is a biceps anchor, or the attachment of the biceps at the glenoid, which is unstable. So we probe it. You can see it's completely unstable. You can see the superior margin of the glenoid. We're looking at the posterior labrum, anterior superior labrum. So this is a biceps anchor. My probe can go below the biceps. That is a sign of instability. So we plan to refix the biceps anchor to the biceps to the superior part of the glenoid. Other part of the joints were also probed, found everything okay. So we shave off the superior part of the glenoid and with the help of the rasp remove all the fibrous tissue to get the bare bleeding bone, so that once we stitch the biceps anchor, the healing is proper, creating a superior portal. Through the portal we are putting a drill sleeve for the anchor. Aim here is to stay away from the cartilage. If you are very near the cartilage, our anchor will be subchondral, or it might penetrate into the joint also. So it has to be properly placed. Again, this is not a very good. We have to go a little bit more medial. And once we do it, but it was not sitting properly, slipped. So we do it again, go more as medial possible as possible away from the cartilage. So once we are happy with the sitting of the sleeve, we use drill. So drilling in the superior part of the glenoid. Once you drill properly, then we use tab. So tab has to be done properly. Many times when instruments are used many times, or there's a wear and tear, you can't see very clearly laser marking, though we can see that there's a laser mark there. But if it is not prominent, there's another laser mark on the outside which can be used as a guide to know how much we have to go in. So once you tabbed it, take an anchor. Care should be taken that you should not move the sleeve. If sleeve is moved or angle has changed, then anchor will pushing, it can break or disengage. So this is a laser mark we were talking about. Once we have gone to the desired depth, we remove the sleeve and try to see what is the purchase of the anchor or strength of the anchor. It is good. Then we take all the threads, all 4 threads, because it's a double loaded anchor, all 4 threads into the anterior portal. So we've taken blue threads, and we take tiger ones also. So all the threads are into the cannula. So now we'll take a bite into the superior labrum. So instrument, arthropiers or any other similar instruments to get the bite through the tissue is taken. Now we are in the joint. We'll just go posteriorly, just posterior to the biceps anchor into the labrum. This is a good bite, and with the tiger thread, you feed with the help of a knot pusher. We are taking this into the superior part, but we have to retrieve the thread into the joint because not thread is not visible. So with the knot pusher, same thread, but beyond the bite, you have to take it from the superior part to the cannula. Now we're putting a cannula into the superior part so that we can do better suture management in the superior part. Again, taking a thread back into the cannula which we retrieved, same thread which we retrieved into the cannula earlier. So it is taken back again because through the cannula suture management is better. So thread is in the superior cannula. Now we'll take a second bite. So what we plan to do? So we're taking putting a knot. Second bite so that there's a mattress in the tiger. Second bite again through the posterior, just posterior to the biceps anchor. And again feed the second tiger thread into the arthropiers. So we have taken a mattress suture. So two bites both through the tissues, so it has become kind of a mattress which gives a better hold. So now we're tightening it. You can see pus pointing it. So that gives a good fixation of the biceps anchor to the glenoid superiorly. Now taking a for the second suture, here we are using a spinal needle going just through the labrum, just anterior to the biceps. So once we have passed the needle through the tissues, through the labrum, we pass a chia through it. Once we have passed chia, we retrieve chia. Then we pass the thread through the chia, so thread is through the labral tissue. So one bite is taken. Now preparing ourselves for a second bite. So this is just to get the thread, because thread is hidden. If you don't take the thread, then can't see the thread. This is the thread which is already taken a bite. Now we take another bite through the tissue. In which is just anterior. It's coming very close to the cartilage here, but that's a good bite. Past here through the needle. Same procedure as for the previous one. So it's a repetition of the same procedure because you're taking a mattress, so both threads will be going through the tissues. So yeah, both threads are through the tissues. Now we already fixed tiger posterior to the biceps. Taking another knot just anterior to the biceps, so getting a repairing the slab. So we're retrieving the tissues, making sure they're coming through the both are coming through the cannula, so that we don't have any entanglement of soft tissues in it. Through a sliding knot. And we tighten it using a pass pointing technique. This is how we're doing a pass pointing, getting a good strength. Then we throw 4 or 5 half hitches. Continue the process of putting half hitches. Once we are sure that we have a good amount of knots and purchase is good, then we cut the suture. Now we, after the repair, we'll just probe it again, compare it with the previous. This is the, so biceps anchor is very well fixed to the superior part of the glenoid. So I'm just putting my probe inside the repair and it's not moving. It's a good repair, good anchorage. Thank you.